So what exactly is mucositis? Mucositis of the mouth is a side effect of chemo and radiation therapy. It's one of the most painful and debilitating conditions a person can experience. The mouth may appear red and inflamed and may bleed with a strong burning sensation. Often, extremely painful sores or ulcers develop throughout the mouth and throat. The first signs of redness and inflammation usually appear about 3 to 5 days after the beginning of chemotherapy or radiation therapy. Here's a picture of grade 1 mucositis, which, as we said a minute ago, is that redness that you can see kind of towards the top center of this picture. And mucositis is put on a scale or graded from 1 to 4, with 4 being the worst and most painful. Mouth sores or ulcers generally develop a couple of days later. These extremely painful sores can extend down into the throat and take up to 2 weeks to heal. This is grade 2 mucositis, which, like I said, is more painful than grade 1 and is progressing towards grade 3 or 4. 4 out of 10 patients who receive chemotherapy will develop mucositis to varying degrees. And here's grade 3, and by this time it's becoming difficult for the patient to even eat solid food. In bone marrow transplant and stem cell transplant patients, the numbers are twice as bad. That is 8 out of 10. Here's grade 4 mucositis, which by this time it's pretty much impossible for the patient to eat solid food, and the pain is so bad that many times the patient cannot get pain relief at all. Throughout the years, many different types of treatments have been used to try to reduce the pain of mucositis and to help speed healing of the mouth. These treatments range from relatively inexpensive products such as saltwater rinses and different mouthwashes such as chamomile mouthwash or antiseptic mouthwashes, to complex and some very expensive therapeutic agents such as narcotic analgesics, which can range anywhere from prescriptions you pick up at the pharmacy all the way to the patient having to be admitted to get IV narcotics, to antiseptics, to artificial saliva, and some oral hygiene measures. Despite all these efforts, the fact is that nothing's been effective. That's right, nothing has been effective in reducing the pain and healing the ulcers of oral mucositis. In addition to being ineffective, some of these treatments cause side effects that worsen your quality of life and further complicate an already difficult situation. Mucositis is not restricted to cancer patients. It frequently occurs in patients with weak immune systems such as people with AIDS, the elderly, and those taking other immunotherapy. So there's a desperate need for treatment that is not only effective and convenient, but more importantly safe. I have good news for you. That need's now been met with OraSoothe liquid oral wound gel, the effective, convenient, and safe treatment for mucositis.